Welcome to the International Congress Agorà regarding aesthetic medicine. We have here the honor of having with us Dr. Massimiliano Brambilla. You are an expert regarding the surgery, the plastic surgery, the reconstructive plastic surgery, and also the regenerative plastic surgery for genitals. How is now the situation?
Well, actually, we started with genital restoration and genital surgery so many years ago, and actually we started with regenerative surgery in medicine of the genital area, I would say around 20 years ago. And what we see now is that there is an explosion and a recognition of what we started to do many years ago in terms of results, technologies, and even if we look around during the meetings around the world, the number of sessions dedicated to genitals and genital restoration are booming. The reason is because for many years we worked hardly to promote the concept of regeneration in certain kind of pathologies, and then by the time we had publications and scientific evidence, and now we are in the next level where we made the science and we are starting to distribute the information to the patients. So even patients are, the number of patients that benefit from those techniques are increasing.
1 month ago you have just published a very important scientific paper.
Yeah.
Just talk about us.
Well, we are very proud of that. I've been working for 25 years in a public hospital, strictly in contact with gynecologists, and lichen sclerosis, that is a very bad disease of the genitals, is one of the pathologies I studied more, and we published several papers through the years, but recently, a month ago, as you said, we published a paper on the long-term follow-up. It means the efficacy of regenerative treatment of fat-derived cells injected in the genitals in this pathology, and the efficacy at long term, it means around 10 years. And what we demonstrated is that the efficacy was still there. And this was the first paper ever published that demonstrated the safety as well, because we didn't even observe one cancer evolution in those series. So we are very happy and proud of that.
The first paper in the world.
Yeah.
So compliments. And regarding genital mutilation, we have a big problem. You are an expert. Which are the data?
The data are, I would say, horrible and terrific from both sides. By number, we have to think that around 250 million women around the world suffer of this, and we have to think that around 80,000 female, there are 80,000 female in Italy that had a female genital mutilation. And with the immigration, the number of immigrants that is growing day by day, and with many of those women that are coming from areas where there is this kind of procedure, I think that in the next years we will have an explosion of this kind of problem in our hospitals. So we need to have new guidelines, a new way of treatments, and even to assist those women.
More information, more possibility to cooperate also among professionals, and what about the scientific new treatment? About them, did you talk in the different section here in the Agorà Congress?
Yeah. Well, actually, the Congress of Agorà this year is fantastic and never been so beautiful. It's an international meeting and it's plentiful of great names coming from all over the world. And the sessions that I'm coordinating are multiple. There is a session dedicated to anatomy and the upper third of the face, 3 sessions on genitals, 1 on buttocks, and 1 on regenerative medicine, aesthetic medicine, so multiple. What I'm seeing now in this meeting is that the cooperation between experts from around the world is multiplicated compared to some years ago. And we are so happy about that, because it's just by talking and talking with people that are coming from different countries with different expertise that our science will grow.
So it's very important to be present in international congress like this, in which you can meet together, discuss also clinical cases, and give information to patients.
Yeah. This is a melting pot. When you come here, in this place, with so many people around, there are always the chance to talk with someone that have a greater experience than the experience that you have, and it's so interesting to keep the idea of someone and to develop and making the idea of someone your idea, and then to develop your idea and to give your idea to someone else. This is called exchanging, and this is medicine.
So thank you very much. We thank you, Dr. Massimiliano Brambilla, for your time, and we thank you also you to be with us, and just keep on listening to us.